welcome you to this course this afternoon, quality management, and I hope it's going to be a very interesting course at the end of the day, which of course it is. All right, how has been all our lectures? I want to believe we have been following and doing our assignments very promptly. Take everything we are doing very, very seriously, including your lectures and your assignments. So once again, you're welcome. It's good to have you. And we're going to be starting this course with the introduction to quality management. I believe everyone can hear me. Introduction to quality management, and I also believe you can see my screen very, very clearly. Now, quality is a very, very important concept today in the world and in the society. Everywhere you go to, people are looking for quality products and services. When you go to buy something, you ask, is this quality? In other words, is it good? How standard it is what I'm about to get. So we're going all through the course, we're going to be examining quality, not only with respect to products, but also with respect to services. And we're going to be examining quality in different aspects. We could have quality in medical and healthcare. We could have quality in drugs, that's pharmacy, quality in education. Somebody says, I want to get a quality education, quality in construction, quality in food industries, in manufacturing, and the rest of them. So quality cuts across every field of society. There is no place that we cannot talk about quality and its importance, okay? And one way or the other, every one of us is interested in getting quality products and services. Now, the thing is that quality has to be achieved together as a team. Okay, so imagine you have an organization or an entity or a work environment where you want to bring in to produce quality products and services. All hands must be on deck, and all aspects has to come together for you to to have quality. That's what we say, that a chain is only as strong as its weakest link. And so if there must be achievement of quality, then it has to be by teamwork. Everyone must come together for there to be quality. Now, for the want of time, I'm not going to give us a history of how quality came to be, but know it that a time came where
under any circumstance.
Hello, can you hear me? So a time came where there was a deliberate introduction of quality into products and services. Now, you see that in 1984, the World Health Organization published an article called Health 2000 Program, where it says that by the year 1990, in the health sector, every member of states, that there should be in place effective quality assurance system for patients. Okay, that is for medical care, and that is just for one aspect. Okay, it doesn't only has to do with healthcare, even different aspects. Okay, and so we're going to be looking at quality assurance, we're going to be looking at quality control, but quickly we're going to get other words to help us to understand the meaning of the word quality. We can say that quality is a standard. Okay, quality is excellence. Quality is a degree of standard that every other person has to meet with. So if, for instance, in your school system you're told that A is 70, okay, I believe we're together and you can hear me clearly. A is 70 marks. So anyone that scores above 70 has scored an A. Now, irrespective of whether you score 75 or whether you score 98, both of you are going to be graded A. Why? Because the standard says once you are able to achieve not less than 70, you're going to be categorized or classified as an A student. And so quality cannot be judged in isolation. There has to be a standard, and that is why we have regulating bodies. We have regulating bodies today. We are, like in Nigeria, we have some Standard Organization of Nigeria. We have NAFDAC, National Agency for Food and Drug Administration and Control. These are quality regulating bodies. NAFDAC regulates food, regulates drugs, especially, then we have some regulating every other product. So when you buy a product, you are maybe a food product in Nigeria, you're looking for NAFDAC. Why? You're looking for the seal or the number of NAFDAC because you believe that once you have seen that number, it authenticates the validity of that product. So also SON, internationally, when you see SON, you say, okay, this is standard body, and it has been said that this product is fit for use based on this seal of quality, such that if you do not see the seal or mark of either SON or NAFDAC, you will assume that these products are not of standard. Just the way you have ISO, which is International Organization for Standardization. So all these are regulating bodies that helps to manage standards in our environment. So we're going to look at the introduction to quality management. We said in that respect, the term quality management is perhaps more apt to describe what is involved here. Optimization of medical care, still looking at quality within the medical line. Now, we said the term quality is often used. We let other people know, for example, where they can buy good sausages, where they can get good customer care. We praise quality for of an unchanging high standard. If we go on with discussion, you realize that people are always looking for quality. Okay, so the term quality entails, of course, not just quality, not just product quality, but also other factors to be considered, such as price and customer quality. So according to ISO, okay, which we said means International Organization for Standardization, what is the meaning, what is the definition of quality? Quality of a product or service is determined by the quality of the totality, I beg your pardon, of features and characteristics of a product or service that bear upon its ability to satisfy the stated or implied needs. Okay, now we're not going to look into the various aspects of quality that has developed, evolved over the years, but this is a standardized definition by ISO and also the British standard, that quality of a product or service is the totality of both the features of that product and the characteristics of the same product and its ability to satisfy the need that is at hand. Okay, so based on that, we can see that quality is the absence of faults, quality is the absence of errors, quality is the absence of mistakes. Okay, so it's somewhat interesting definition you can see. So quality is when the customer and not the product comes back. Now this has to do with product recall. What is product recall? When a product is not good, you buy, let's assume, a TV set, or you buy a telephone, a mobile device, and you take it back and you want to use it and you discovered a fault in it. You are likely to return that product to the manufacturer or to the buyer because of a quality problem. So we said quality is when the customer comes back to buy and not when it's returning the product. And over the years, we have had issues of what we call product recall. What is a product recall? When a manufacturing company produces a product and later on they discover that the product has an error or a mistake or a major quality problem, and that product is withdrawn back to to the manufacturers, or yes, they are called back. It's called a product recall. So product recalls occur when products have fault and they are discovered and they are withdrawn from the market. They have to, the sales are stopped and everything is returned back to the manufacturer to make for correction, because those products, if left in the market, can have a lot of harmful effect on customers. So quality assurance of the quality of a medical service. Okay, just an addition to what we have been looking at, with respect to quality. So what is quality assurance? Don't forget the course is quality assurance and of course quality control, in totality called quality management. Okay, so we have looked at quality, we have defined what quality is, we have looked at the fact that everybody desires to have quality products and services, be it education, be it healthcare, be it medical, all of that. So and so we're going to be defining quality assurance and quality control. Quality assurance and quality control. I believe we are following, and I also want to believe you can hear me very clearly. We're going to look at quality assurance and quality control now. Okay. So now quality assurance is the part of quality management that ensures that the process in which a product or service is being done, and in the case of a product is being manufactured, is followed according to the required standard. So I want us to understand that quality assurance is process oriented. Quality assurance is process oriented because in quality assurance, our goal is to follow the required standard in terms of how a thing is to be done from the beginning to the end, in order to give assurance that that product is, is of standard or quality. So, for example, we talked about sausages earlier on, using that as an example, that you might be asking your friend that mall or that eatery, their sausages is very good. Now, we said the sausage produced as per ISO 9000 standards or from the farmer remain unchanged if sausage tastes good to us and the price performance ratio is in order, we are satisfied with it. So this is further explaining the fact that when you make a comparison over time, because every product must have an adequate shelf life, okay? Every product must have an adequate shelf life. What is a shelf life? Shelf life is the time between manufacture and the expiry date. So if a product was manufactured January 2019 and is going to expire March 2020, between January 2019 and March 2020 is the shelf life of a product. Okay, so we are saying that if you do not follow the required process of how a product is to be produced, it will not meet the required shelf life. If you do not follow the quality assurance system of how that product is to be produced, then you are not going to get the required standard and it's not going to meet up with its shelf life at the end of the day. So various methods are employed to ensure that standard level is achieved and is maintained, something that calls for what? Continuous control and documentation. Okay, so we just looked at quality assurance now, and we said it has to do with the process and what is to be put into that process between manufacture of the product and its end. Let me also define quality control, even though we have not gotten there. Quality control is whatsoever you are going to do to a product after it has been produced to ensure that before it goes out to the market, there are no defects, there are no errors, and there are no problems with that product. It's called quality control. Let me take it again. When you have produced a product, you will not just send it into the market. There are various tests, checks, and inspection that has to be done on that product or service. Now, those checks for errors, for mistakes, to make sure that this product has been produced in the right quality assurance system before it goes out to the consumers or the customers, is what we call quality control. So quality assurance and quality control work together. They are both called quality management because quality management is an overview of, it's more of a broader perspective or headline that houses both quality assurance and quality control. So know that quality assurance is process oriented, whereby quality control is product oriented. Quality assurance is process oriented, whereby quality control is product oriented. All right. So quality management is a continuous, planned, and well-targeted endeavor to improve a product or service. Quality management calls for commitment from all occupational groups. Quality management never refers to the shortcomings of an individual employee. Okay, all right, we are moving on. So let's look at one or two definitions, okay, which I've already defining some from the beginning of the class, but let's still look at some other few ones. The first is quality policy. What is a quality policy? Quality policies are understood to mean an organization's intentions and efforts with respect to quality. In most cases, quality policies are expressed in general terms. For instance, people help people. That guiding principle determines the action of our what? Hospitals employees. Okay, they are also called upon to ensure their actions are carried out in manner that is economically feasible, environmentally friendly, and efficient. So a quality policy is it's an organization's intention, effort, those systems that are put in place to ensure that quality is achieved. So what is our quality policy? You enter an organization or an office or a place and you see a banner with their quality statement. It's also called a quality policy or quality statement. In other words, these are the guidelines we follow to ensure that we achieve quality. It's called a quality policy. Okay, then we have quality assurance, which I've already defined earlier on. Then we have also defined quality control. Then we have also talked about quality management, which is a continuous plan and well-targeted endeavor to improve a service or a product. Okay, so the next is quality management philosophy. Quality management philosophy. Now, quality management system is not a rigid construct within an organization. Rather, it is a dynamic process within the organization aimed at continuous improvement. Now, I want you to note the word dynamic. When you say something is dynamic, you said it means it is continuous. It means it's in motion. It is not static. It changes. So we said a QMS, quality management system called QMS, is not a rigid construct. They are not just general rules and regulations that people have to really judge. You said it is a dynamic process because quality is in a dynamic state. That was one of the definitions that was given by one of the scholars in quality. He said that quality is in a dynamic state. In other words, there has to be improvement, there has to be changes. We are having online classes. Why? Because quality has to be in a state of dynamism. It has to be dynamic, it has to be improving. Okay, and so we cannot close our lectures because of the challenge of pandemic that the world is having. We must develop another system to still administer education and knowledge. So quality is in a dynamic state, be it healthcare. Back then, in fact, the way medicine and the medical field is going, with time, the need to cut people open will drastically be reduced. Why? Because of improvements in quality that can produce a lot of supplements, drugs, and the rest of them, technology that can treat people without necessarily taking them through operations. Okay, so quality is in a dynamic state, and know that everyone in the organization is responsible for quality. Talking about who is responsible. So you work in an office or you're in your school, you're in your home or whatever it is, you cannot place the responsibility of quality on one person. Everybody in the organization is the customer of a predefined work process and is at the same time the supplier. So in other words, we receive services that therefore everyone who is a customer expects perfection and is aware of the same perfection. In other words, we expect or will supply us with properly arranged assets for reprocessing, or expect us to return properly packaged sets. In other words, everyone in the organization directly or indirectly influences the quality of services and how they are rendered, and is thus responsible for this. Therefore, at the core of quality efforts is each and every member of staff. You can see that highlighted where the mouse is pointing within this box. That therefore, at the core of quality efforts each and every staff member is involved. So we are saying that quality is not just the responsibility of the quality team. You cannot say, okay, the QA/QC department, yeah, you are the only ones responsible for quality. No, they are the one that has been charged with the responsibility of leading quality, but everyone within the system is still responsible for quality. Okay, so it's just like an example. Look at Nigeria. We cannot say the government is only responsible for fighting corruption. No, every citizen, from the least, of course, to the president, has to also be involved in the fight against corruption. In the nation, everyone has to be involved in the fight against this pandemic. However, there are authorities that have been vested with that responsibility, but you and I still have a role to play. So everyone is also responsible for quality. Even the way you do things in your environment, in your home, in your school, tells a lot about how you appreciate quality or not. So that's very important. The next subtopic we're going to look at is what is called process management. You can write that in your notes. Process management. Process management. Now, processes are activities that, taken as a whole, create a value for the customer, e.g., warm and healthy food that tastes good. In general, these functions are of an overlapping nature and are carried out by an interdisciplinary team. Often, working tasks are viewed as separate activities. E.g., if my job is to pack instruments, if everyone sees his job as an isolated task and loses sight of the overall process, problems can easily arise. This is due to the case of a department. This is true to the case in the case of a department, and is much more in a large interlinked organization such as a hospital. We are taking a hospital as a template to understand quality management. Now we're looking at process management, and if you recall, at the beginning of this lecture, of this class, I said quality cannot be judged in isolation. And just a few minutes ago, I also said you can see where my mouse is pointing. Even if everyone works with your body, okay, or no, there's no join up thinking, then major problems can occur. For instance, again, taking a hospital as an example, a hospital has employed an award-winning chef able to produce delicious dishes, but because of the long distances to be covered, the food is cold when it's served to the patients. This type of task division, where everyone sees only his job, is called functional work division. Quality has to be teamwork, has to be joint effort. We have to see every process as one unit that has to be united together to achieve quality. So the chef in the hospital does not see himself different from the janitor in the hospital, and the janitor himself doesn't see himself different from the nurses, and the nurses don't see themselves different to the doctors, neither do they see themselves different from the cleaners. Yes, everyone has their responsibilities, but the responsibilities must come together. So if the doctor wants to treat a patient and the environment is dirty, has not been cleaned, then that's already bringing problem, because you cannot attend to patients in an unhygienic environment. So there has to be togetherness, there has to be oneness, and everyone has to be, there has to be that cooperation to ensure that quality is achieved. So from the diagram below, we can see what happens when everyone works well, but in isolation. If you can see all the men working on the rail, if they don't work together, then there's going to be the process management is going to be a lot of an issue. Okay. Process management is understood to mean the fundamental approach whereby the entire organization's activities are viewed as a combination of processes or process change. The goal here is to assure continuous improvement through continuous improvement of the processes. Okay, if you look at the body system, for instance, let's look at the human body system to be able to achieve, to explain the process management a bit further. We have different organs in the body. We have the liver, we have the, our body parts, and all these organs and systems, the kidney, the liver, the heart, the pancreas, the excretory system, respiratory system, all of them have their separate functions, but however, must work together as a team. Okay, and it's so funny that once one part of the body has a problem, it can affect the whole part of the body. So it is the same thing. So let's look at management processes. Okay, the types of the types of process. So management process is the first type of process, and we said management contributes to the strategic business management. Example: budget, planning of medical facilities, or planning for whatsoever is needed for the achievement of what quality. So this is where management input comes from. So if you want to achieve quality, management must have a vision, must have a mission, must have a goal, must have its plan in place to see that quality is achieved. So that management role, it must contribute significantly. Okay, so the process type, the first process type is what? Management process. Management must bring its process to see that, must bring its input, must bring finance, must buy equipment, must recruit staff, must train staff. All of that is the management responsibility. Then what about the second process? Is what is called operational processes. Operational processes. Operational processes. And operational processes contribute directly to the actual work involved. They contribute directly to the actual work involved. So still using our template of the hospital. So this is where you now have staff like nurses and the medical doctors that are carrying out their jobs or carrying out their work. In the school setting, we have the lecturers, we have the teachers in the construction, we have the engineers that are working on site and all of that. In the manufacturing sector, we have the manufacturers, the quality control, quality assurance, the production manager. All these people are the ones responsible for what the processes. They contribute directly to the actual work that is involved. They contribute directly to the actual work that is involved. So they are in charge of what the processes. So the first one we talked about was management process. Then the second one is what? Operational process, management process, and operational process. Then the third is what we call supporting process. The third is supporting process. Okay, so management process, operational process, and supporting process. Now, in supporting process, it contributes indirectly to the organization's working activities. Okay, contributes indirectly to the organization's supporting process. Indirectly. So it refers essentially to provision of all requisite materials. Now, within any organization, there are people that contribute indirectly to the system. There are people that contribute indirectly to the system. They are not there to necessarily bring in any job per se. So they might not be the one treating, they might not be the one attending to patients, they might not be the one attending to people, but without their input, things cannot be done. So for instance, in schools, you might not have the person that is producing your books, okay, producing your biros, producing the chairs, the desk, that produce the blackboard, that built the school itself.
You don't see them, you don't necessarily need them directly in the education process. But if they are not there, how do you pass knowledge? We are able to use IT, media, IT, yes, media and technology to have lectures all over the nation. Many of us are in different states of the federation. Why? And we're using a laptop, we're using a phone. These are supporting processes or devices that are helping to be able to fulfill that overall plan. So don't forget the types of processes we have. Our time is running. We have management process, you can see that here. We have operational process, and we also have supporting processes. I would say supporting process are not needed directly, but without their input, even the responsibility of those that contribute directly can be jeopardized. Okay, I believe we are following, and the class is going very well, and we are taking notes. Okay, because at the end of the day, we're going to have an assignment that we are going to do and of course submit before the next class. Okay, so next, what do you need for functional quality management? What do you need for functional quality management? Within a system, what are the requirements that must be there for quality management to be able to function effectively? And the first here is what is called structure. Structure. To function well, a central supply department needs a manager, deputy manager, you need a staff. So you need to develop a structure, and every system must have a structure. Nigeria has a structure. We have the president, we have the vice president, we have the senate, we have the house of reps, we have the ministers, we have departments, we have agencies, we have the governors, we have the chairman. That is a structure in which the parliamentary system runs. Okay, we also have, in a school setting, we have the vice chancellor, we have the deputy vice chancellors, we have the chancellors of the school, we have senior lecturers, we have non-teaching staff, and all of that. Within the company, you have the managing director, you have the assistant directors, you have regional directors, you have state directors, and all of that, local directors, and all of that. So that is what is called a structure. So within your quality management system, you must have a structure that creates for functionality. Okay. Then you must also have, in general, the structure is illustrated in the form of organisms. You can see it just by the right. You can see these beds at the top. You can see next to, you can see other beds, and goes like that. So that creates a structure where there can be separation of powers, reports, responsibility, and knowing how for effective management and running of that system. So the next is training. But the structure of it is of little benefit to us if staff are not well trained. One of the reasons why staff cannot deliver in terms of quality in manufacturing, in healthcare, in services, is when they are not well or properly trained. You have to train your workers to be able to deliver quality services, to produce quality products. In fact, a famous quality quote by Henry Ford says that, we cannot put into our system anything that is useless or that is not of value. Okay, and another famous quality quote is says quality is doing it right when no one is looking. If we have to monitor you for you to do the right thing, then we have not been able to train you enough to know that quality you have to do it right whether we are seeing you or not. Okay, so that is a test of quality. Will you do it right if I will not be discovered? But it's okay, so in many countries, special training courses are run for medical services, for schools, for manufacturing. Induction trainings are done where you train and build your staff into how, the quality policies, the quality system. You build your staff to understand how to carry out their responsibility, how, to implement good customer care, and how, they can also duplicate quality in their various units and departments. So very important, there has to be training. Then all workers have to understand their duties and responsibilities. Workers have to understand their duties and responsibilities. Don't forget, what are we looking at? I hope you're still with me. We're looking at what is needed for a functional quality management. I said we need a good structure, we need staff training, and staff training, there has to be a good understanding of what duties and responsibilities. Each staff and members should be aware of their duties, they should be aware of their responsibilities, they should be aware of what they are supposed to do. Okay, a situation should not arise whereby during the night shift, person who has to be on duty is not around, something happened and he wasn't sure, and all of those kind of challenges. Sometimes everyone should know their duties, responsibilities, and well spelled out if we must achieve quality. Then there has to be standard and right procedures. Okay, operating procedures have been known to us for centuries in the form of, for example, cooking recipes, an example. And really, this operating procedure is often known as SOP, standard operating procedure. And you see, a standard operating procedure is actually a document that details all the required processes that are necessary in any area or field. Okay, so there's an SOP in water treatment for you to have your clean water. There's an SOP in car manufacturing. There's an SOP in manufacturing your drugs. There's an SOP in services. There's an SOP in producing your foods. So it's called a standard operating procedure that everyone within that. So even if certain staff are not around, anyone that comes, so long as they have that document or manual, can refer to the SOP, the standard operating procedure, and use them and use it to carry out the process that is meant to be done. So operating procedures are intended as a means of ensuring that all employees will discharge their activity in exactly the same manner, because there is a standard, because there is a guideline, because only by doing so can we achieve quality. And don't forget that quality is a scientific system, and anything science can be harmonized. Anything science, anyone can duplicate it. Okay, the same chloroquine, as it were, that treats malaria in Abuja, for instance, we treat the same malaria in what? In Lagos, treat malaria in Bauchi, in Kaduna, in Enugu, and anywhere. Why? Because it is the same standard that can treat the same disease. So it is scientific. So what are we saying? Is that what, if you have an operating procedure, a standard operating procedure, anyone can use that same template and reproduce the same result. So as we wrap up today's class, let me quickly do an overview within the next few minutes. We started this class by looking at introduction to quality, and we were able to define what quality is. We said quality is a measure of standard. It's an excellence. It's a degree of grade. Okay, we said quality is in the dynamic process. Everyone wants quality products and services. And we further went to define what quality assurance is. And we said quality assurance is process oriented, where whatsoever you need to put in between step A, from the manufacturing or from your raw material production to the end, whatever you put in between that process, which shall be seen as the course goes on, is called quality assurance, to give assurance that that product is of set standard. And whatever you're going to do to the product, you're going to carry out checks to make sure that there are no mistakes, to make sure that there are no errors before that product goes out to the market, is called quality control. So that is quality assurance and quality control. Then we also went ahead to look at processes. We looked at quality management. We talked about quality management, and we used a hospital as a template to explain and define that. We now went about to talk about QMS, that's quality management system. Okay, quality management system. Then we looked at some terminologies, quality policy, and we added quality management. Okay, as we have already defined, I would say quality is in a dynamic state, and so all hands must be on deck, because quality is the responsibility of everyone. There are only leaders in quality, those that have been charged with the responsibility of leading, but however, everyone still has a role to play. Then we looked at process management, and we said there has to be effective teamwork to achieve quality. Then we looked at the process types, the types of processes that exist within the quality management system, within the QMS. and we looked at the three types of process that are available. The first is management process, and this is the contribution. The management process is the contribution of management into achieving quality. In other words, they must provide facilities, they must staff, they have to have a budget, they must buy equipment, they must bring in all the required materials, both physical and otherwise, to see that what the facilities, manufacturing, buy the right equipment, gadgets, for carrying out analysis, high performance liquid chromatographic equipment, and the rest of all those equipment for ensuring standard must be. But then we have operational processes, and we said these are those that contribute directly to the work that is involved. Okay, so if you have the nurses in the hospital, the teachers, in the school, and all those that are contributing directly to the process of achieving quality, the manufacturer, the production manager, the quality assurance and quality control inspectors, all these are those that we call that are responsible for the operational process. Then we have the supporting process, which we said they contribute indirectly because they are not necessarily involved directly, but without their provision, without what they bring in, then even achieving quality will be difficult because we buy equipment from them, they supply us the required materials, even though they will not be there. The man that produces your biro that you use to write might probably have not even gone to school, like you. So, but his requirement is needed, his support is needed to see that. So thank you so much. I'm going to dictate my assignment and the email where you are going to submit that assignment. Here's the email. Okay, nizelo@gmail.com. This is the mail where you're going to submit the assignment. And what is the assignment? Now, if you're listening, I have just like 2 minutes more. So write the assignment down. Write the assignment down. What are the courses? What for quality products and services in Nigeria? What are the causes of poor quality products and services in Nigeria? Okay. Second question. Submit to that email I've sent. First question, what are the causes of poor quality products in Nigeria? Second question, has there been cases of product recall as a result of poor quality? Has there been cases of product recall in Nigeria as a result of poor quality? Has there been cases of product recall in Nigeria as a result of poor quality? And the last question, how does quality assurance and control apply? How does quality assurance and control apply in your field of study? Okay. So how does quality assurance and quality control apply in your field? These are the 3 questions you're going to be doing. I've typed them out. First of all, I've given you the email to submit to, useloa@gmail.com. So the first question is there. Second question, if there are cases of product recall. And the third question is how it applies to your field. Thank you so much for being part of this class, and I wish you a happy afternoon and wonderful rest of the class and lectures. Thank you and have a great day.